welcome to Whiteboard Medicine. How are you guys? Hope you all are doing great. So, moving our discussion in the series of anemia, let's talk about new anemia. That is, sideroblastic anemia. It occurs due to presence of ring sideroblasts in the bone marrow that results from abnormal utilization of iron during erythropoiesis. To know which iron gets deposited, you have to know the source of iron, that is, hemoglobin. The hemoglobin have 2 alpha and 2 beta molecule. Each molecule binds to 1 oxygen moiety, and the combined structure carry 4 oxygen moiety. Structure also have 2 globin chain. So let's know the structure of single molecule. Each molecule have 4 cyclopentane ring, also known as pyrrole ring, and have central heme, and forms the base for the structural molecule, which is basically in reduced Fe2 plus form. But sideroblastic anemia occurs due to non-heme iron and pyrrole ring. Question arises: how the non-heme gets deposited, and how the Fe2 plus iron gets converted to Fe3 plus, and which factors leads to deposition of pyrrole ring. But how? For this we have to look into the pathway of heme formation. Heme formation is a process that starts from mitochondria and ends in mitochondria. It starts importing glycine, an amino acid that is non-essential, means body can produce this amino acid on its own and gets combined with succinyl-CoA, that is a intermediary product of citric acid cycle. They both forms aminolevulinic acid in the cytoplasm. This is synthesized by the enzyme name ALA synthase, also called as aminolevulinic acid synthase. Defect in this leads to accumulation of protoporphyrin, which has pyrrole ring in itself. But how Fe3 plus iron deposits? To understand this, we have to look into the membrane of mitochondria. The normal membrane have protein bound to itself named ferrochelatase. It combines the Fe2 plus iron with protoporphyrin and helps in the formation of heme. But in conditions like sideroblastic anemia, aminolevulinate synthase doesn't work, and then this leads to formation of barrier for Fe2 plus, and hence the ferrochelatase, which was helping Fe2 plus, now creates problem. To exaggerate this problem, ferrochelatase helps Fe3 plus iron to get easy entry. This leads to accumulation of Fe3 plus and it disturbs ETC chain. After knowing the pathology of this anemia, one question must be arising in your mind: does RBC have nucleus? Yes, RBC have nucleus. Megakaryocytes goes through various stages up to reticulocyte. It have nucleus, but sideroblast appears in the middle stage, and apto stage, reticulocyte. The process occurs in bone marrow. So bone marrow provides the house for immature erythrocyte. Hence, if someone wants to look for sideroblast, he have to look in the bone marrow. It forms the important base for diagnostic approach. Generally, sideroblast does not appear in peripheral blood, but in few patients it may appear. Let's dive into origin of disease. It occurs due to mutation of genes of heme synthesis. It's the major mutation. The second mutation is mitochondrial metabolism enzyme defect, and the last is iron sulfur mutational defect. The another most common sex-linked mutation is X-linked mutation. It's the most common primary mutational defect. It leads to mutation in aminolevulinate synthase, and also in enzyme name adenosine triphosphate binding cassette. And the last enzyme mutational defect is glutadoxin 5 defect. These are all primary defect. Let's know the secondary mutational defect. Overuse of drugs is the first main cause. Patient may be a drug users from long time, excessive use of antibiotic can lead to mutation in bone marrow that can hamper the growing erythrocyte. Ingestion of toxins can lead to occurrence of severe form of anemia. Copper chelatase and copper deficiency also causes the secondary anemia because copper plays vital role in the process of erythropoiesis. The last cause is chemotherapy. In the patient of cancer, the presentation of patients with sideroblastic anemia include the common symptoms of anemia, which are basically 4 major symptoms, such as fatigue. Fatigue can cause a vast range of other physical, mental and emotional symptoms. The second symptom presented is malaise, a general feeling of discomfort, whose exact cause is difficult to identify. Along with it, the specific symptom presented by patient is shortness of breath. This symptom will tell you that there is some problem in RBC, and the next symptom which will shift your diagnosis towards anemia is appearance of pale skin. The laboratory diagnosis is Pearl's reaction. By using Prussian blue dye on complete blood count, the patient have MCH in very low level. The shape of red blood cell means RBC width changes dramatically, and it is in all-time high. Hence the name blast is given to this anemia. Along with it, patient have both types of RBC in blood, that is microcytic and macrocytic, and this leads to create confusion in young doctors. The treatment of the patient with X-linked anemia is pyridoxine 50 to 100 mg per day orally. This have shown a good recovery of patient. For patients who are not responsive to pyridoxine, blood transfusion is indicated if they have severe anemia. For patients who require chronic blood transfusion, it leads to many problems in organs due to excessive iron deposition. The main organ which goes under defect is liver. It causes hemochromatosis. It leads to irregular heartbeat and impaired metabolism. Hence it is recommended to start diferoxamine or oral chelators when serum ferritin is more than 1000 nanograms per liters. Let's know how the patient reacts to the treatment. There are 2 types of anemia. In secondary acquired sideroblastic anemia, the prognosis is good. In X-linked sideroblastic anemia, proper pyridoxine replacement and iron overload management will improve the prognosis. However, if not well managed, the prognosis may not be up to the mark. So if you have watched our video till now, please share the video with your medico friend or the one who is interested to know the medicine. If you have any comment or suggestion, please comment down below in the comment box. We would be very happy to respond you. Please like the video and don't forget to subscribe our channel and press the bell icon. Best regards from team Whiteboard Medicine.